Well, welcome back. Here we are in module 7, and this is the module where we're going to talk about day 2. And day 2, I like to call the courtship time. Now, there's lots of different ways and lots of different methods to educate a patient and get them to sign on to your care in your office. Some practitioners will use day 2 as a time to do a report of findings. Some practitioners will adjust the patient first or take care of the patient first and then go through the report of findings. Some choose to do the report of findings first. I'm going to talk to you about a different way to do the patient education process over day 1, day 2, and a day 3 to help you to really build a relationship with that person and help them to understand exactly the need for long-term chiropractic care, for wellness care to get their spine and nervous system corrected, not necessarily focus on their symptoms. And this is a great way to build a family practice. And I'll show you exactly why. This is the system that I and my wife used in our practice to start a practice from scratch. And in 30 years of practice, we built a practice to 1,200 patient visits a week for the majority of those years. We collected a lot of money. We saw a lot of people, just had a wonderful, fulfilling practice. And the number of people that stayed in our practice for years was astronomical. The practice was not new patient dependent. We had a real base of warrior patients who just kept coming in regularly because they knew the value of lifetime chiropractic care. So this is the system that we used. So day 2, we call the courtship. Well, let's kind of think about the big picture. And we said in module 6 on the day 1 module, we talked about the fact that if we assume every new patient just wants a quick fix, they want to come one time, they want to pay as little as possible. I like to compare it to the first date. If day 1 was the first date, now we're going to take them through the courtship time where we're going to go out together, we're going to get to really know each other, fall in love. So eventually on day 3, we're going to ask them to marry us. That's the analogy. So here we are in the courtship model. So this is the time where we really need to get in state and we need to really own how devastating subluxation is. If we have done the exam, we've taken an x-ray, or we've done some postural tests or ranges of motion, we've done a nerve scan, we've done the type of testing to detect, find interference in the nervous system, to find subluxation, and we found it, especially if we do see any type of degeneration, that's a serious thing. And it's really our responsibility to make sure that that patient knows how serious that is, because if we don't get that message across, that patient goes home with that lack of knowledge and their spine continues to degenerate and decay and get worse. And we've really been responsible for affecting their life in a very negative way if we don't help them to understand how serious that is. And then when they know how serious it is and we've done our job properly, they can choose whether they want to have care in our office for the long term or not. So the objective is here is we really need to get into state. We really need to make sure that we come into the room and have this interaction in a way where that patient understands that we are very serious about what we do. We're acknowledging the fact that they have come in with some sort of symptom. We're trying to get to the underlying cause of the problem, but it's a serious problem. So we need to elevate the concern. So we're going to elevate the concern of the patient to their underlying condition. This is very, very important. So we want to give them a comparison to normal. If a normal spine has good curvatures, proper curvatures, and we can show them an example of a normal spine with proper lordotic curvatures in the lumbar and the cervical spine, we can show them an AP view of an X-ray and see that it's straight. And then if we know that they have some sort of a scoliotic curve, or they have an alordotic spine, or they have lumbar disc degeneration or osteophytes, we need to be able to explain to them that this is a serious problem. So my concern for them, and this is how I phrase it, uh, I've done a thorough check of your x-rays and your exam findings, whatever testing you use. I've done a thorough check of your posture test. I've done a thorough check of the ranges of motion studies we did or the thermal scans we've done. And my concern is that this is a serious problem. You do have subluxation. That is the root cause of the pain that you came in with, back pain, neck pain, headaches, whatever the problem was that brought them in. So that is the root cause. But here's the big concern, and this is really important in the communication. That underlying problem is not only causing the symptom that brought you in, it's also affecting the nerves that may go to the associated organs. For instance, if it's a lower back pain and they have subluxation patterns or degeneration in the lumbar spine, it may be affecting nerves to their digestive organs, to their intestines, to their kidneys, to their liver. So wherever those nerves are associated, of coming from the spine where the damage is, they can be affected. The nerves going to the periphery, going to the musculoskeletal areas may be affected as well and causing that pain, but the nerves going to the organs absolutely will be affected as well. They come from the same nerve roots. So that's really important to relay that to the person. So those nerves going to those organs are also being affected. So my concern for them is that if this gets left, what's going to happen? And that's my question to them. Is this going to get better or worse? And ultimately, if the patient understands that and I've done my job properly, they're going to naturally say, well, it's going to get worse. Absolutely, it's going to get worse. So here are your choices, right? And I give the person the option. Here are your choices. You could decide to do nothing and just leave this, or try to cover it up, do some stretching, take some medications, try to cover up the symptoms. Is that going to affect or correct the underlying problem? And of course, the answer is obviously no. You could go the therapeutic route, get some physio or get some quick fix chiropractic care that might give you some relief and help you to feel better and get you more mobile and functioning at a better level for the short term. But is that going to correct the underlying problem long term? If you've got degeneration, if you've got an abnormal structural curve, and ultimately the answer is going to be no. So then the question is that do you want to spend the time and effort and resources to get this problem corrected? And if the answer is yes, then you invite them to go through with their first adjustment. So if it doesn't get corrected, is it going to get better or worse? It's going to get worse. And ask permission for them to go through with their first adjustment. So if you'd like to do this, I'd like to go ahead and talk you through your first adjustment. But after your first adjustment, we're going to arrange some time for you and your spouse to come in and see your x-rays. Because of the damage I see, it's really important that we spend special time to do this. So that's relayed on the second visit. So we get the process started. We talk them through their first adjustment. We explain how we're correcting subluxation. We explain the cracking noise, that nothing's cracking, it's just gas escaping. And we talk about what to expect afterwards. You may feel different. It's like we've broken open the dam. Things start flowing better. So some people feel better immediately. Some people feel no change. Some people feel worse. That's all normal. The body reacts very differently in different situations. So let them know that these things can possibly happen. It's the start of the corrective healing process. So it's only the beginning. So we go through that, and then what happens afterwards? Well, we may decide, some offices do some comparative or corrective testing. Maybe they take a weighted x-ray. Maybe they do another nerve scan to compare, so they have something to show the patient on the report of findings day to say, here's your pre-adjustment test, here's your post-adjustment test. This is what we can expect to happen through the course of care. So that's an option as well. At the end of day 2, we book the doctor's report or the report of findings. So whether you do a group doctor's report, which I highly recommend, that's a great way to build a good family practice and get your mission out to a lot of people. Plus, it's a great way to save time because you're doing a lot of the educating in a group format, and we'll talk about that in the next module. You invite the spouse, and this is how we word it often, is that many people ask us, and I would say this directly to the patient, many people ask us at this point, because they're concerned about what they're going to see on their x-ray, can my spouse come? Can my supportive person in my life come to see those x-rays with me and help me to make a decision on this? Help me to make a decision on my finances, on the time it's going to take to get this corrected, help me to really understand what's going on with the seriousness of this x-ray. Can I bring somebody along? And we highly recommend that. So that's why we're going to schedule yourself and ask them who's the most supportive person. In most cases, it's the partner or the spouse, and set time up for them to do that. If it's a group report, we have set times for that. Or if we do a one-on-one report of findings, we would set a specific time out of office hours where we're not interrupted to do that report of findings. We go and hand it off to the team. And this is something that we train on regularly, to go to the team and say, hey, Diane, this is John, and I just had a chance to talk to John about what we found on his day 1. John just had his first adjustment. And Diane, I'm really concerned about what we did find with John's x-rays and his spine. He does have severe subluxation processes in his spine. We did get a good first adjustment to get started, but we're going to set some time up to go through his exam findings with him and his wife, Marcia, on Thursday night at 7 p.m. So Diane, what I'd like you to do is schedule time for John and Marcia on Thursday night at 7 p.m. so they can come in, go through the doctor's report, explain what's going on, and then we'll talk to John about his x-rays and the next steps. Diane takes the handoff. This is something that we've trained on. So she knows what to expect, she knows what's coming, and she knows how to manage the objections, which we will get into in different modules. So Diane would explain to John exactly what happens. She would do John's checkout, take any payment for day 2, and then explain to him what's going to happen on day 3 on the doctor's report night. And we had a handout to give them of what's next. And it would explain exactly what's going to happen, manage objections, talk about preparing to make a decision that night after they see their x-rays on their care plan, that will have a specific care plan recommended for them. And then the follow-up, the closing of day 2. At the end of the day, I had one of my CAs give me a list of all of the people that need special phone calls, which included all the day 1s, all the day 2s, and anybody who needed extra attention. And I would make those calls at the end of the day. Typically, I would do them in my car on the way home. I would just click a button on my phone and it would link up to their phone number. That's the way we had it set up. And I would make that day 2 phone call. And the day 2 phone call was just something very simple. And I would call John and say, John, Dr. Colin here. I just wanted to check on you to see how you did after your first adjustment today. And no matter what John said, I would say that was exactly what I expected. John says, oh, I'm terribly sore. Like I got really worse. John, that's exactly what I expected. That's sometimes how the body responds. That's actually a great sign because it means we started making some change. This is going to take some time to correct. I'm really looking forward to seeing you and Marcia on Thursday night at 7 o'clock at the doctor's report, and we'll answer all of your questions at that time. So I don't get into a big long conversation with John. It's just me checking on him. John says, great, fine, we'll see you on Thursday night. So I confirm the time. And it's so great because you're really helping bridge this relationship. You're helping the courtship, which is day 2, obviously, and this bridge to create the relationship and create the trust of this person so that by the time they come to the doctor's report and see their exam findings, they're ready to start care. They're pre-qualified and they're ready to make a decision. So this is the general high-level overview of day 2. It works extremely well. It does take some training and working with your team, but it's a great way to build your practice for the long term. Hope this helps. I will see you in the next module.